It has been a year and a half since I had my gender reassignment surgery, and I'm as happy as I can be. Finally, I feel like how I feel on the inside matches on the outside. I have a vagina, everything is just so great for me, and I don't have to worry about tucking or anything like that. I can wear the clothes that I want and be comfortable in my body. The day before my surgery, I wasn't even nervous. I was just so excited and focused and happy that this moment in my life was about to happen. I felt very comfortable with Dr. Tang. Like right when I met him, I knew that he was going to do a good job. And he also specializes in doing surgery on suppressed youth and who have been on blockers and hormones from a young age. That was really important for me because I never went through male puberty, so I had a lot less penile skin to work with down there. And he is really great at making the most out of what is there.
Emily was 100% prepared for surgery. She'd done her research. She had been thinking about it for many, many years, and she was very well prepared for the consultation and had a very smooth recovery and outcome.
The process to qualify for the surgery involved me needing letters from my pediatrician, my endocrinologist, and my therapist. I needed all of these letters just to have evidence that I am transgender and that this surgery is something that I wanted. And legally, these letters are required to have the surgery as well. My doctor told me I need to get laser hair removal to make the surgery process a lot easier so that there would be no hair down there and there wouldn't be any hair growing inside me. Also, to prepare for my surgery, I had to do bowel prep the day before, so I couldn't eat anything and I could only drink water.
It's a day you've been waiting for.
Yeah.
For your whole life.
I had my gender confirmation surgery when I was 17 years old, and it was 2 months before my 18th birthday. And there were moments after the surgery when I was still healing and when I was in a lot of pain, but I know to this day it was so worth it, even if there were those moments where I questioned it. My best advice to anyone interested in having the surgery is definitely do your research, keep your options open for surgeons, have multiple consultations to figure out specifically what you would want. Personally, for me, my whole life, I've known that I wanted to have surgery. When I had my surgery, it felt like my whole life had led up to that moment. But not every trans person wants to have surgery, and every trans person's journey is different, and every trans person is different. And there's no right way to have a transition.
99% of patients, after hearing all of the complications, will still want to proceed with surgery. I think that just shows how important these operations are to our patients.